device in order to obtain tighten of the skin and in order to work for rejuvenation of the face and the neck. I have worked a lot with radio frequency, infrared, and I have good results, but the problem of the laxity of the skin and also the muscle and facial laxity was a problem. So I think the ultrasound, the focus ultrasound, is the answer for this kind of problem. And I start use the first focus ultrasound, the Ultera. It is a good and a new device, I think more or less 3-4 years later. And I found it very, very interesting, this kind of technology. And when my Italian distributor gave to me this new ultrasound, this new device, the Ultraformer, I think I was very, very impressed for a lot of characteristics of this device. It's much more, it's very, very faster, so you can treat in a very, very fast way the patient. I think it is very, there are a lot of entities, the 4.5 that permits me to treat the deep surface, the deep structures like facial and muscle, and also the 3 millimeters that can work in deep dermis, so you can stimulate in very efficient way the fibroblast and the new collagen deposition, and also the new, the innovative 1.5 millimeters that can treat also the superficial wrinkles, the periorbital area and the forehead. So I think in this way the Ultraformer becomes a very complete treatment in order to rejuvenate all the problem of the face, the skin laxity, the wrinkles, and also the relaxation of the deep structures like fascia and muscle.
What are the reactions of your patients in terms of pain?
I think all the treatments of skin rejuvenation, from the surfacing with the CO2 lasers, the non-ablative erbium blast treatments like Fraxel, and the radiofrequency with microneedling, that in my experience are very, very important treatments, but they are very painful treatment. I think this kind of treatment, the Ultraformer treatment, the ultrasound, the focus ultrasound, are not so painful, and it's much more accepted by my patients. And the most important characteristics is also the possibility to obtain the possibility to come back to the normal life in immediate way. So I think for the patient it is very, very well accepted.
So there's no downtime, you can just go back to work.
In this way the patient, a little redness, a little erythema for half an hour, 1 hour, and the patient is completely perfect. So he can the next, in Italy, the next day you can go to the sun, to sun exposure. There are no problem of sun exposure. You can treat all the skin types. In this way is very, very, very well accepted from the patients.
So could you just tell us the satisfactory level of your patients?
I think the level is high, very, very high. From 1.10 degree, I think the level of satisfaction is 9, because we have an immediate result, and this is very important for the patient. And also this continual improvement of the result is very important in the following 2 months. So the patient joined a very, very high result and high level of satisfaction.
Yeah, who do you recommend to have an ultraformer treatment?
I think the best candidates for this kind of treatment are the patient from 40 to 60 years old, and with problems with skin laxity of the face, the mandibular border, the jawline, deep nasolabial fold, and skin laxity and muscle laxity of the neck, the platysmal bands, and also the wrinkles of the forehead and the periorbital area. I think that these are the best candidates, and it's most important that Italian patients have this kind of problem, because they have thin skin. Thin skin is very, very it's a good